My name is Mark Irwin, and I am the interim co-executive director of Ruth Ellis Center. The Ruth Ellis Center's mission is to create opportunities with LGBTQ plus young people to build their vision for a positive future. It was a Memorial Day weekend in 1999 when 16 community members came together to brainstorm an idea. How might we support LGBTQ young people who are experiencing rejection from their families and living on the street, experiencing homelessness? They came up with this idea of Ruth Ellis Center as this safe space for these LGBTQ plus youth because there was literally nothing in the Detroit area at the time to support them. The Ruth Ellis Health and Wellness Center has really been a pivotal program for the organization. And I think even more than we ever anticipated. It all stemmed from us really learning about HIV infection rates for the city of Detroit. In 2012, the CDC had released a report that indicated that while the city of Detroit represented only 9% of the total state's population, it represented 3/4 of all new HIV infections. And the primary group of individuals where they were seeing that was for 13 to 19-year-old African American, gay, and bisexual men, and African American trans women. We knew those were the young people that we were serving. And it was really alarming for us to hear that information and to hear those numbers. So we began doing focus groups with young people in the drop-in center space to hear about how they were accessing primary care services. And what they were telling us was actually really, really eye-opening. And it was devastating, but eye-opening in that young people were accessing primary care services in spaces where they were being discriminated against. They'd be in crowded waiting rooms where people would be gawking or making fun of them. Trans young people wouldn't be offered the opportunity to provide their preferred name, and physicians not being equipped to ask the appropriate questions. And those are just a little bit of the things that were happening. That's just a small sense of their experience. But what it indicated to us is that we needed to do something because throughout those focus groups, we also learned that about 40% of the young people that we were already serving were living with HIV. And what we had come up with was we could sort of rethink our first floor facility in Highland Park so that it could include a clinical space, therapy rooms, exam rooms, a lab space, waiting area. We toured several of Henry Ford's community and school-based health programs, existing programs, to see really what you can fit in 2,500 square feet. And from that, we determined that we could build the space and we could invite volunteer physicians, local medical students. Our incredible behavioral health team would provide the individual, family, group counseling, and then we'd provide some cultural competency training for any primary care physicians or medical staff that were to come into the space to ensure that it remained a safe space for the LGBTQ young people at the center. And ultimately, through that process, Nancy came back to us and said, Henry Ford wants to be a formal service provider with Ruth Ellis Center at the Ruth Ellis Health and Wellness Center. And for us, it was this moment of what just happened, right? We had this idea and we knew something had to get done, but in our minds, we were just this small grassroots organization. And here's this huge health system, and they want to be a part of it. They want to support the young people in a way that they had never been able to do previously. And with that, we began construction and entered into a service agreement. And in 2017, I remember the exact day when it opened for the first time, and young people were literally standing up in line waiting to see their doctor. As I think about the legacy of Ruth Ellis and this incredible organization that has achieved so much and still has so much incredible work to do, I can't help but think about those who believed in us right from the very beginning. And so on behalf of my colleagues here at Ruth Ellis Center, the board of directors, and the young people who come to the center each and every day, thank you to the Community Foundation for Southeast Michigan for believing in Ruth Ellis Center from day one. In fact, I looked up the records, and the very first gift was in 1999. the exact same year that the organization was founded. That means a lot. That means that you've been with us on this journey this entire time. And we cannot thank you enough for that support, for that guidance, and the continued belief that LGBTQ young people deserve more. They deserve to have opportunities, the same opportunities that are presented to all young people. They deserve to have access to housing, to employment. They deserve safe spaces where they can access basic safety net services. They deserve gender affirming care so that their behavioral and primary health care needs are met. They deserve to have the life that they dream. And we can only do that with organizations like the Community Foundation for Southeast Michigan. So thank you.